Yes. Yeah.
So we can stop.
Let's start. Good afternoon, everyone. Today, I will be presenting a case conference of a 39-year-old Hindu female, third in order out of 3 siblings, an M.Com graduate currently giving home tuitions to students in GK, commerce, and belonging to middle class socio-economic status according to modified Kuppuswamy classification, with an identity mark of black mole 2 into 3 centimeters, 5 centimeters from the wrist joint on the extensor aspect of right forearm, and a black mole 2 into 2 centimeters on the left angle of mandible. The informants are her 45-year-old brother who studied till MCA and currently working in a coaching institute and teaching computer sciences, but he has not lived with the patient throughout the illness. Her 72-year-old mother who has lived with the patient throughout the illness. Her 79-year-old father who retired from BHEL in 2005, who has lived with the patient throughout the course of the illness, and her 42-year-old brother, who is currently working as a software engineer in Dehradun itself, also the patient herself. The history given is clear and coherent, but it is not consistent. History couldn't be corroborated amongst all of the different informants, making the history not adequate. The complaints are insidious in onset, continuous with a progressively deteriorating course. Irritability, the chief complaints being irritability and anger outbursts for the past 8 years, suspiciousness for the past 8 years, decreased sleep for the past 2 years, precipitated after she was made to leave her job at local BSNL office, where she worked as an accountant by her father, who insisted that his daughter would not cope up with the work pressure, and that his daughter should not work till late, that is till 7, 8 in the night. The patient was apparently well 8 years back when, after she was made to leave her job at the BSNL office, her family members first started noticing that she would get very irritable the minute her father would ask her to do anything, even if it was a very menial task, for example, to fetch him a glass of water. In one instance, she threw the glass of water and rushed towards her room and locked herself in. On being asked how she was doing or what are her plans for future now, she would become really aggressive and would become very rude with her family members. It was also during this time that she started to get into more and more disagreements with anyone and everyone in her house, and this became a daily occurrence. Following these complaints, she was taken to a local mental health practitioner, and she was prescribed antipsychotics, but she outrightly denied to take any treatment. Now, also during this time, her elder brother, who had married against the wishes of the family back in 2005, started to come back in contact with the family. This occurred in the year 2014. The informant further divulged that the proband started to get increasingly concerned about her sister-in-law's involvement in the process of decision-making of the household. She started staying increasingly vigilant if anybody even came close to her mother or tried to sit beside her, or for that matter, even tried to talk to her. The informant then reported that the patient began leaving the windows and doors ajar to try to hear what was being talked about. She even started to think that whenever she leaves a room, everyone starts to talk about her. It was also during this time that she started taking tuition classes for class 5 children. Now, following these complaints of suspiciousness and irritability, the patient was again taken to a mental health professional in the year 2015, wherein she was prescribed medication, but due to lack of follow-up, the treatment, lack of follow-up and compliance, the treatment was never really properly followed. Her complaints of suspiciousness further increased when now even her younger brother's wife, initially living in Gurgaon, moved to Dehradun, and even she became a regular visitor in the house. She now started to get increasingly verbally abusive, not just towards her sisters-in-law and brothers, but even to their children. And this occurred whenever they would come to the house. Citing her further deterioration, her parents urged the brothers to get her admitted in a hospital. Following these complaints, she was now admitted for about 7 days in the month of June in 2017 and giving a long-acting injectable and was discharged on medications. It was during this time the patient now started regular follow-up. There was significant improvement in complaints of suspiciousness and irritability towards the end of 2017, to the extent that she even started to welcome the idea of meeting her brothers, but still not the sisters-in-law. But after being compliant for about 1 year, towards the end of 2019, the family members together proposed that the elder brother move with his wife and children from Ghaziabad to Haridwar and start living next to their house. Despite the Provand's repeated oppositions that they all do not move, they all did eventually make the move, and they started to live in a house close to hers in around 2020. Now the informant reports that she stopped greeting and meeting if him or his wife would come to the house. She started keeping to herself and continued with her tuition classes, all the while not taking medications. Towards the end of 2020, there were again instances of irritability and anger outbursts towards her mother and father. Her complaints of suspiciousness also increased, wherein she now started to report that everyone is trying to take control of her house and property. She would repeatedly insult and have disagreements as well as physical altercations with everyone, now becoming a daily habit. Citing these concerns, among the family members, they got a few medications prescribed themselves from a mental health practitioner, but the patient again refused to consume them. Following this, the family members decided to mix the medications in the food and then give them to her. But on one occasion, the patient again saw her own mother mixing something in her food, and since then the patient even refused to eat anything cooked by anyone else but herself. When she would be unable to cook, she started to now hide fruits in her almirah and refrigerator, but would eventually forget about them and they would ultimately become rotten. The patient decreased her interaction with even her mother, now refusing to speak or eat with anyone. She started to keep images or framed photos of a god in all four corners of her room. And if questioned about the same, she would get very irritable. Now, after this disagreement about the photos, her cupboard was forcibly opened so as to clean it, but her family members found old garlands, clothes all thrown together inside. Now, following these complaints, following this incident, the patient started to get physically abusive towards her mother, and due to the following reasons, she was brought to the hospital. So there. Negative history, there is no history of thoughts being introduced into or taken away from mind by an external agency against the will. No history of own thoughts being heard aloud or being known to others against the will. No history of hearing voices not heard by others. No history of self-muttering, self-smiling. There's no history of sustained over-cheerfulness, over-talkativeness, over-familiarity, big planning, or over-grooming. No history of repetitive thoughts or compulsive acts. No history suggestive of any eating disorder. No history of any low mood, pessimistic thoughts, suicidal ideation. No history of substance use and dependence pattern. No history of head injury, loss of consciousness, abnormal body movements.
You know, yes, yes, right. Now, in your here, you guys mentioned the constant progression.
Sir, I mentioned the,
You mentioned,
yes, yes, I mentioned the onset and the post first. Chief complaints. Yes.
So all progression get ready, right? Progression is the development percent. Or the radial illness
Yes.
nowadays
So that they're trying to take control of her house and her property. They're trying to manipulate the mother. Yes, yes. They were a little jealous about her progression because she's an MCOM graduate and they were jealous about her success, her getting early success in life compared to the rest of the girls. She cleared her college before her brothers in first attempt only and मतलब वो fail वगैरह भी हुए थे but she got first division herself but subsequently CA exams में she could not मतलब pass. Yes.
But when the patient tells you now, has to be in a message. If there's something, अभी आपको पता है तो आप कैन क्वेश्चन इम्प्लीमेंटिंग क्या पेशेंट है मैंने now yeah the other is better the order of this point is that you document that readability and but other than this
Yes. Mention that only that they are trying to take her house.
readability states that norms is part of lot of academics. So when we had tried to take up history and establish presentation, we need to guide something. Guide is the concept again I will take this. The presentation of readability, the control of readability, the preparation of readability, the handling of the accessibility, how it works, how it was affecting the patient component. So readability stages then you say it is very important. It is your information when you will measure that. So so this was quite a lot of focus on the things which are not organized. See, this is medical practitioner. If you need to mention this, it should take it from somewhere that has okay, also not mentioned, that is fine. People don't see them, that no, people are the common. But when you go there, is the family. The family मैंने तो से उसके से start completely nice better girls than the patient. So although maybe there are more clear I understand, but still 8 साल में बाहर तो क्या ठीक है.
Sir, in these actually 8 years, the patient has lived with her parents, and the brothers, they have not been with the patient, and they have given their account and home that was really broken. The father is a little hard of hearing. He has mild to moderate to sensory neural hearing loss, and mother was citing the patient ki mujhe nahi pata and all of that. She had a little bias towards the patient. So the history, everything that we could collect was either through the phone yesterday, and then I called him this morning, which is then one of the brothers he came and that is yeah.
Then we cannot come with these. Diagnostic power, then we need more help. Okay, we cannot say Shabi adequate diagnosis. So diagnostic cannot be the whole of this. Okay. And academic but what we need to make diagnosis but when we get information for this so then diagnosis is very difficult. We want to know that going from a DH or want to so block the treatment in mind. Second year, clinical
So treatment history in the year 2014, she started taking treatment from September 2014. And she was started on tablet risperidone 4 milligrams in divided doses, tablet clozapine 100 milligrams in divided doses, and tablet clonazepam 1 milligram in divided doses. Due to poor compliance and a lack of follow-up, we could not assess the proper response or the side effects due to the medication. Then again in the year 2015, she was started on tablet olanzapine 15 milligram in divided doses, tablet clonazepam 1 milligram in divided doses, tablet long-acting injectable of flupentixol 20 milligram BPIM, and so this she was given in the month of June. Following this, again there was a lack of follow-up, so we cannot assess the proper response and the side effects of the medications. Then from June 2017, when she was admitted in the hospital, she was kept on injectables therein. Before her discharge, she was given again a long-acting injectable flupentixol 20 milligrams, and she was discharged on tablet olanzapine 10 milligrams in divided doses. And so since then, she had been on regular follow-up all throughout 2017 and 2018, wherein subsequently long-acting injectables were given in the months of July, August, September, October in 2017. Following that, sir, improvement was seen in her complaints. Then, sir, in January 2018, her medication from olanzapine was again stopped to aripiprazole 5 milligram in divided doses. And sir, this continued till November of 2018. So no treatment history is available from the year 2019, 2021, and then presented to the complaints in 2022. Past history, there is no significant past medical or surgical history. Family history: she is third and mother out of three siblings, living with her parents. The economic head of the family is the father, and the emotional head is the mother. The patient has been close to her mother since childhood. The family supports the patient but fails in having regular follow-up. There is also history suggestive of dementia and maternal grandmother. Birth history: full term normal vaginal delivery, home birth, cried immediately after birth. There's no history of fever, cyanosis, prolonged jaundice, breath holding spells, abnormal body movements, or any admission to an ICU. There's no antenatal exposure to X-rays or toxins. All developmental milestones were achieved as per age, and the patient was completely immunized as per schedule. Childhood history: there is history of temper tantrums, but no history of hyperactivity, inattention, repeated bullying of other children or by other children, stealing, lying, setting things on fire, nail biting, thumb sucking, bed betting, or stuttering. And the patient would share her toys with other children. Home atmosphere: there is no history of any broken home, desertion by parent, step parent, or adopted sibling. The patient has a strained relationship with her father. Scholastic activities: the patient started schooling at 4 years of age. She was shy in school and did not participate much in extracurricular activities. She passed her 10th and 12th with first division. The student even passed her MCOM in the first attempt with the first division and showed a desire to become a CA but couldn't clear her exams. The patient attained puberty at 11 years of age with the start of Thilarki, followed by Minarki at 12 years of age. This was then followed by Vivarki, and finally the growth of axillary hair at the age of 14 years of age. There's no history of any consensual sexual act present. Her LMP is of the 28th of March 2022, duration of 4 days with a normal flow. There is no history of dysmenorrhea or any abnormal uterine bleeding. Now, the pre-morbid personality: the patient was ambitious. She had good social interpersonal relationships and would fall back on her brothers in times of need. She does not have any long-term friends and showed an unwillingness to become involved unless certain of being liked. There was greater involvement in religious circles which hold prayer meetings and other such programs together. She would abide by the law and respect the social norms, and but she would be excessively sensitive to setbacks and have a regular sleep cycle. This gives us an impression of anxious and paranoid traits in her personality. So following is the general physical examination.
You can tell what is possible.
So she's thin-built female with 33 kgs weight and height of 150 centimeters. So pallor was present. Systemic examination was done. Pallor was present. Should I start with the answer? The patient walked into the room accompanied by her mother, unaided, with a bilateral wide-arm swing gait, sat on the chair unsupported. She greeted the doctor back. She is a thin-built female, looks as per stated age, wearing appropriate attire of a pajama and a t-shirt, moderately kempt with average personal hygiene. Thin hair tied untidily into a plait. Eye contact was initiated and maintained. She had a cooperative attitude. Rapport was difficult but established. Psychomotor activity was normal. Speech was normal in tone, volume, intensity. It was spontaneous, relevant, clear, coherent, comprehensive. It was goal directed, and reaction time was normal. Prosody was present. Then the cognitive functions. In attention, she could not do serial subtraction of 100 minus 7. She could only do up to one place. This was followed by 40 minus 3. She could do it up to 5 places. Then in concentration, she could not name the months backward in a year, although she could tell the days backward in a week. Then she was oriented to time, place, and person. Her memory was intact. Her abstract ability was intact. She could tell three similarities as well as 3 dissimilarities between apple and an orange. She could tell the meaning of proverbs told to her. Mood was subjective. वैसे तो ठीक हूँ पर ये लोग जलते हैं ना. Affect was quality irritable. Full range. Reactivity was present. The affect was communicable. It was labile. It was not labile. It was not. It's appropriate and congruent with. Thought. So, giving an example of the verbatim, आज आप कैसा महसूस कर रहे हैं? The patient answered, ठीक हूँ डॉक्टर साहब, looking towards her mother. आपका यहाँ पे कैसे आना हुआ? मैं आना नहीं चाहती थी, मुझे जबरदस्ती ले आए हैं। कौन जबरदस्ती लाया था? ये जो आप देख रहे हैं, pointing towards her brother. लेकिन आपके साथ तो आपकी माताजी आई हैं, वो तो इन लोगों ने ही जबरदस्ती भर्ती करवाया है। लेकिन वो ऐसा क्यों करेंगे? ये लोग इतना जलते हैं कि ये कोई भी हद तक जा सकते हैं, ये कामयाबी इनको बर्दाश्त नहीं होगी। क्या आप अपने बड़े भाई को दोष देंगे इसका? वही मेन कल्प्रिट है और आजकल उसने मेरे छोटे भाई को भी मेरे खिलाफ भड़का दिया है, पॉइंटिंग टुवर्ड्स हर ब्रदर अगेन। और इसकी हाफ माइंड बीवी यही मेन कल्प्रिट है। क्या आपके खिलाफ ऐसा क्या किया है इन्होंने जिसकी वजह से आप ये मानते हैं? ये मुझे जबरदस्ती भर्ती इन्होंने मुझे जबरदस्ती भर्ती करा दिया है, मुझे पागलों के बीच में डाल दिया है, ये कम है क्या? लेकिन इनका तो मानना है कि आप बेबुनियाद शक करते हैं। जब मेरे खिलाफ इतना कुछ किया है, अपनी पत्नी के साथ मिलकर मुझे पागल बना रहे हैं, मेरी जायदाद हड़पना चाहते हैं, फिर भी आप इसको बेबुनियाद कहोगे? जिस दिन मैं भर्ती हुई थी उसके एक दिन पहले तक बच्चे मेरे पास ट्यूशन पढ़ने आए थे। अगर मेरा दिमाग खराब होता तो मैं क्या पढ़ा पाती? आपने बोला कि जायदाद हड़पना चाहते हैं, उसका कोई सबूत है? मुझे आपसे बात नहीं करनी है, जब मैं कह रही हूँ तो मैं क्या झूठ बोलूंगी? स्टार्टिंग टू गेट इरिटेटेड एंड वांटिंग टू लीव द रूम। ठीक है, लेकिन आप इतना बता दीजिए कि ये ऐसा क्यों करेंगे? मेरी और मेरी मम्मी की अच्छी लाइफ को खराब कर रहे हैं। जलन है इनको मेरे से, सिर्फ मुझे पीछे धकेलने की कोशिश है। क्या घर के बाकी लोग भी यही मानते हैं? पता नहीं डॉक्टर साहब, इनके झांसे में जो आया होगा वो तो मानते ही होंगे। इनके जिस बर्ताव को देखकर आप इस नतीजे पे पहुंच रहे हैं कि आपके खिलाफ षड्यंत्र रच रहे हैं, क्या इसका कोई और कारण हो सकता है? सर, मैं आखिरी बार कह रही हूँ कि इनके सारे एक्शन ये बताते हैं कि मुझे आगे नहीं बढ़ने देना चाहते और मेरे खिलाफ आगे भी प्लान करते रहेंगे। मैं पक्का यकीन से बोल रही हूँ कि ये इनका किया हुआ है, इससे आगे मुझसे कुछ मत पूछो। एंड the impression of this is that the patient had no formal thought disorder. She had a normal stream. Possession was self with the content of delusion or persecution. No perceptual abnormalities could be elicited currently. Suggestive of dementia in maternal grandmother, with history of diabetes, mellitus, hypertension, and mild sensory neural hearing loss in father, presented to the OPD with complaints of persecutory ideas towards the brothers and sisters-in-law, irritability, anger for the past 8 years, and decreased sleep and restlessness for the past 2 months, with a cooperative attitude, irritable effect, delusion of persecution, impaired judgment, and insight of grade 1. She has provisionally been kept on a diagnosis of persistent delusional disorder and a differential of paranoid schizophrenia. All along this time, she has been regular tuition, but the functionality in terms of her profession or the work that she is doing was intact. And how she was behaving socially with other people was intact, but not with her family members. That is what was mentioned. So with her family members, it was impaired, but not outside the house. She was she started again welcoming the ideas of talking to her brothers, but then again she did not welcome her sisters-in-law. She started talking to their children, but not them. So I would say that she did not completely touch the baseline. And all along, like I previously also mentioned, that her functionality was impacted. Yeah. Inside is great for the I didn't understand what is inside presently is also great one. And back then also she said कि मेरे को ये लोग ले आए थे जबरदस्ती इसलिए मैं तो अपना काम कर ही रही हूँ लेकिन इनको लगता है कि मेरे साथ कोई प्रॉब्लम है इसलिए मैं दवाई खाती हूँ. That is the explanation.
As the listeners again,
So, one more thing I wanted to clarify. So, about the insight only, the patient has in complete denial of her illness, but then she is saying that she will take medication and she goes and even in the ward, she is easily accepting the medications. Will we say that that is insight grade 2 or
they can have communication however, she is very they are secret, they don't understand. Some people they choose the doctors. That's however, only taking medications will improve the exam answers. Like on writing, we improve things only. But this picture is they have been for long term so different. Which I will say, it is in our process. I don't understand this. I have no reason for being important. System. In fact, I was going to go. That's everything else. So it is आपके साथ उसके बिल्डिंग है आपने तो सारे सर्किट बोर्ड ले लो is it really it is false as it improved by her your doubt was that it is really false it has to be able to prove that it is really in the patient which is absolutely false and absolutely false has to be able to prove in a word or other in the writing field the process and able to आपका गलत फॉर्म डालेगा क्या बोला था उसने writing field but all the belief was probably false ज्यादा क्या
the time take away all the possibility and
that is false
then I
it's false जो आप उससे क्वेश्चन है जो है कंटेंट which actually in lot of cases can be different. So it has to cover development it is false. मैं तीन बार बैठे और वो ये करने के लिए जो बोलना है करना which proves if your development is false. I understand it is false. I know this is we have done it. But the mention it very very clear नहीं है ठीक है आपको पॉइंट होता है the matters all matters must be mentioned when currently आप when we get the exam, you spend at least 3 sessions each patient and we spend at least 2 hours. तो मैं वो पूछूं तो वही वाला वाला सीखा ठीक है अब मेरा क्वेश्चन उसके से आंसर वाला आप तो वो डिफरेंट मेरा आप ऐसा चाहिए डीपीडी कर रहा है ठीक है सब कुछ डाल रहा है लेकिन केवल कितना दिमाग के बेसिकली तो मैं कुछ नहीं कर रहा हूं मैं पहले से बात की लिए आंसर इधर उसने क्या बोला बोल रहा so to get the movement to get the power it is a belief it is false neither it is false nor it is false so to get the better then you go only and the only and the essential you know how to say you have to get the different technology so तो उसके बाद में तो उसको पूरा करना तो सारी डेवलप open up in all these comfortable then available with हमारा बैटरी में उसने कहीं कनेक्शन नहीं किया कहीं पे इसका कॉमर्स नहीं किया कहीं पे एक्टिंग ऑफ नहीं किया वो यहाँ पे लाए इससे इंडियन मॉडल so and yeah
sexual history so history of any dogs yes I shouldn't have used that word yes
so
yes
I have to prepare a lot of things there. It really has been a clue. The question is stated. It is then come to what are the most of the question is stated. I'm going to say, I mean, it's giving the whole
Yes.
all the interpretations. But this is not the similar. All the vectors is living on her brother. They existed. Or brother or their sister in law. Maybe there is a cell phone from the state data of the number. Then you have to get it there. But it's still a lot of things, but they don't over
Yes.
that of this species. The core is there, right? It's not data of data. That's like going. That's why that is covered where there is that is not this is what I am going to say. As we are here, still also say is not hard. Lot of that we have how can the conclusion of anxious perspective? How to evaluate
So just a few things that she, unless that there was a chance that she would be like, she did not interact much with people. And then school may also she did not participate much in.
That's why there is a when they are teachers, and there is a possibility to get the present. And if that can be that is the scheme of personality is finished. Then you verify that personality has been
I think. Very much. Just
but those things say that's why I say how to work is that is my program. So अगर वो थोड़ी गिरी करें तो वो वेरी टाइम
yes.
and time beyond your normal departmental
Yes.
and academic activities
Yes.
beyond your say the step is Islam defense Islam all and then we develop so details of your symptoms. So these are the only आपको कैरी कर लो अंदर कैरी कर लो पांच कैरी कर लो and that will fish You can yourself. Yeah, what is this? क्या पॉइंट समझते हो So that is a current personality is going to join the so both of them there was just another so what the time she can work this or this is some other what we have put a standing other really suboperative using this is all the base is एक तो थीम होता है ना आप देखो तो उसके अगर ये तो इसके सबटाइटल है तो सबटाइटल एक्चुअली में बहुत है ये सबटाइटल नहीं होता है ना देखा है तो नहीं होता है गैलेक्सी साइज में बोल as per digital communication only ऐसा नहीं कर रहा है कि मतलब बहुत ही जल्दी से मैच करती है ये जो पिक्चर कभी कौन सी अफेक्टेड है कभी कौन सी नहीं अफेक्टेड है इसकी जगह मिला के जैसे वो सब अफेक्टेड है नॉर्मल तो नॉर्मल में सोशल इंटरेक्शन उसी में अफेक्ट हो कोई साइड में क्रिएटिव कोई काम ना करे इंटरेक्शन कम हो गया बाल कम्युनिकेशन इन्वॉल्वमेंट किया 2% कॉन्फिडेंस क्या मतलब है जब को बता दिया 2% that was a difference calculus more personality और psychological है वो भी हो सकता है मेरा अब ये गलत प्रॉपर्टी देखते हैं मतलब गलत जो मैंने क्वेश्चन कर रहा हूं वो करने चाहिए और हाउ कैन इट हाउ इज स्टैंडर्ड स्टैंडर्ड करते जो डॉक्टर आता है मतलब क्यों कि एक बार इंडस्ट्री डॉक्टर का एक्सपर्ट करते हैं तो डिपार्टमेंट में सब बहुत बहुत जगह पे कर रहे हैं मतलब पूरा नेशनल कभी यूनिट एंड but to do this are analysis is there for months or in which they don't evaluate psychiatric illness at all. तो जैसे बात कर रहा हूँ जैसे बात कर रहा हूँ अभी तक तो प्रेजेंटेशन को बोलूँगा कर ले आया ऐसे करेगा but इसमें कंसिडर आगे अगर प्रॉपर्टी बात करें तो यूजुअली in Indian society it is expected that the
inherits
and why so we consider the environment करने की उसको फेस करेगी ओके again family part किसी कैसे तो family part प्रेजेंट अब आप कह रहे हो कि मदर तो मानसिक किया है मदर तो बायोसेट और जो ज्यादा टाइम स्पेंड कर रही है ये सब तो नहीं रिलेटिव टू साइंस वो बायोसेट it's part of the method or the family and it's part of the method or it's a clear psychotic needs so ये भी तो देख सकते हैं बताओ why marriage has not explained now तो क्या हमारे में तो प्लेस लाइटिंग में तो अगर क्लियर तो वो मैरिज जल्दी कर देगा बताओ
initially she rejected a lot of proposals because of her educational status because they were not earning as much as she was But then later on, as her age progressed and everything, so that played in her, that was no longer her favorable business.
So why the family didn't insist on marriage?
They did, so there was this one person that her father was insisting, who was a businessman, but he was only educated till class 12. So she said that I want somebody who's at least a graduate. That was one of the reasons that the father then stopped getting involved in any of the marriage decision making. She did not have any such predilections for anything.
Going over to simple details, why we kind of sit down with that. Is it? How do you speak when this people after?
Cognition. But the one thing that was, although she said that she was doing tuitions and all, but she was not able to do such 100 minus 7. She did that once. Maybe she got so nervous because she kept on saying it, ki, I can do myself. But then this thought also came in my head to teach people. So it's not like you have to study. Yes. But also say she said that I'm enjoying this. She instead asked me a question. Who was the woman Nobel Peace Prize winner? She asked.
When she was not with her brothers, and then how say another more statement created, the
So, like I mentioned in the history, the patient has always had a very strained relationship with her father. But the elder brother, he married without the family's consent, but later on they came to terms with it. And so the elder brother would regularly, and since the father is hard of hearing, so he would, despite being in another room, she could hear that he's talking in an increased volume with someone. Then she would ask the mother, who is he talking to? This became a regular practice that regularly the brother would call the house, and this would infuriate her. That despite not being here, these people are still interfering in what we are doing in the house, and dictating the father as to what to do with the house. Maybe they end up selling this house to them. That is why the father called them to live next to them, and maybe.
Still relation with the brothers is actually decreased in certain extent due to medication.
Yeah, yes. Sir, 2005, we said before that it was fine. In 2014 was when these complaints arose. 38, sir. So from 2005 to 2013, she was just finished her 12th and she was in college, and she मतलब completed her. No. Yes, all along she has been staying with her parents, but never really got along with the focus. Sorry, sir. Got along with the fathers. So because according to the patient, so he has a different notion as to how a girl should grow up, and rather than focusing on the education part of it, she should rather get married before and then maybe pursue after that, but only after that. So but there were always been some disagreements. Yes, I did, sir. So the only thing that she could say was कि वो बात नहीं करते हैं एक दूसरे में, मैं बीच में पढ़ती नहीं.
She was actually like 11 years back. She did some then she then we asking her she just
Initially, sir, she gave a history of 9 months. Then I spoke with one brother, he gave me a history of 2015. Then I spoke with another brother, he gave me a history from 2014. So yes, so temper tantrums, so this thing was again and again brought in front of me, that since she was the only girl in even from her father's side of family, so everyone would give in to all of her whims and wishes. So there is history of temper tantrums and everything, but apart from that, nothing else. No, not at all. Once or twice, sir, the father has. Once or twice, the father has hit her on various occasions. So, BHEL, he was an accountant. Yes.
Actually, here some point become very important. What should be considered to this? Because if there is this type of disorder in this treat to be the baseline, then we should consider that this is partly included in sign. You should not go on increasing the those activity. So, but that percent capable person will have certain things that if they actually want to so the list of time to the cutting style, if they actually want to substitution, we can call this person. We can.
Same.
30 years ago, तो अगर बिल्कुल कुछ नहीं करा ऑफर हुआ तो बहुत मुश्किल है पेमेंट वाले के बढ़ जाते हैं तो वन तो doesn't go in favor of the ये concept
Yes. Yes.
इधर का केसेस इसमें मतलब हमें बाकी सारे जो पार्ट होते हैं इसकी जो इम्पोर्टेंट होता है इवन गाइडेंस में क्या होता है तो वो इसके लिए पार्ट है तो एजुकेशन मोस्टली टर्म्स आएंगे
Sir, abhi she's kept on injectable. हाँ सर, वो आज ही सर अनीमिया
Baseline is that you should really start taking risks that these values
Yes.
simply discuss the issues are will also design MSc that is ISR के कब present करते हैं ठीक है तभी proper presentation होगा बस sir sir is there now sir को spending their time to have to be
yes
with formal it's quite important then we can make it
it's all one question. It's not easily clarity of very